Judy Murioki lived with endometriosis for years without knowing what it was. Just like millions of women across the globe, the condition was initially dismissed as normal painful periods.
I don't know anything like simple periods. They have always been difficult from the very first time I started them in high school. I used to go to the nurse's place and sleep for about 3 days. So I'm missing classes, missing a lot of the learning just because of cramps.
It was until adulthood when she got proper diagnosis and her journey to proper treatment and management began. This was her first surgery.
So that's when I found Dr. Amal. He said, when he did the imaging, he showed me this is it. So for me, other than the pelvic region, it affected my bowel, and it was I was getting shooting pains down my legs. So that's the sciatic nerve, and lower back pain. I was getting migraines pretty much every day. Those are the main symptoms I was having. Even without my period, I could be having headaches, I could be having the leg pain, I could be having the back pain. Only when I have the period is when I feel like lower cramps.
According to Dr. Yamal Patel, an obstetrician gynecologist, endometriosis is a chronic inflammatory disorder which can also grow beyond the uterus and affect the bladder, cervix, intestines, rectum, abdomen, and even the stomach.
It's a complex, chronic, inflammatory, debilitating disease that riddles patients with pain and issues with fertility and social issues, psychological issues. So, endometriosis is a very complex condition that affects many organs, but it's mainly a genital tract disorder. And it can involve up to the blocking of the ureters and causing a kidney loss. It can involve the bowel and causing obstruction in the bowel. It can involve the bladder and causing an issue with the bladder. So it can involve the nerves and causes neurologic pain. So endometriosis basically can involve the lungs and cause patients who are bleeding and coughing blood every month. Can involve the umbilicus, so basically any part of the brain.
Last week, a multidisciplinary team performed endometriosis surgical marathon at Third Park Hospital in Nairobi, where 12 women benefited at a subsidized cost of 50% for the surgeries, which normally costs not less than 1.5 million shillings, with a call to the government to include the condition in the national insurance scheme.
These patients for quite some time. In this endometriosis marathon, we are actually doing around 12 surgeries, all very complex. These are patients who in the past have needed to travel outside the country at times to get their symptoms and condition sorted. It is usually very expensive, and obviously you'll hear many patients who are doing Harambe and collecting funds to actually help them travel and do these surgeries. We are trying to bring this expertise here locally.
The surgeries were also aimed at creating awareness around endometriosis, early detection and treatment. Just like Judy, many other women live with so much pain, procrastinating to seek treatment, not knowing that period pain is not normal.
Because even 2022 it was bad, and it made me have to use stronger medications to solve, and I think just because of always postponing and being maybe it's not so bad, because I was always maybe najifanya. Then now this year, I think between March and July, every day I was not functioning. So even I think the period in July is the one that made me go to see her, because the one I was bedridden and I couldn't even walk, because even I was telling the nurses here that the pain I felt post-op doesn't compare to the pain I had before coming for surgery.
According to the World Health Organization, endometriosis affects about 200 million women worldwide and can start at a person's first menstrual period and last until menopause.
Many women take period pain as normal. However, 1 out of 10 women are suffering from endometriosis, and with early detection, these women can get intervention and eventually live a pain-free life. Robbie Omondi, K24, Nairobi.